This is part 2 of the History Assessment programme on health and the people. Hopefully before you watch this particular video, you've already watched the one on Hippocrates and Galen and the outbreak of disease, which also includes exam technique on significance questions and compare questions. Today, we're having a look at the development of surgery over time and 16-mark factor questions. The third topic then that you're having to revise in order to be successful in this health and the people assessment is the development of surgery over time. So our focus here is going to be on factors, and we're going to be looking at 3 particular factors that help surgery develop. We're going to have a look at war, individuals, and science and technology. If you know something about all of those, this is all you are going to need for the big 16-mark factor question. You won't need to know anything else. Let's have a look then at our first factor that develops surgery, which is war. So war has been a significant factor in improvements in surgery since the Middle Ages. So in medieval times, most surgery, as we know, was done on the battlefield. We know that surgery was incredibly dangerous and people weren't going to have it, and this was absolutely life-threatening. So during the 100 Years' War, we had people like John Ardern developing more effective pain relief. We had the use of opium being used much more than it had been before because it was an essential on the battlefield. We also had war giving surgeons more practice in helping with both difficult and deep wounds, and surgeons came up with that wound man diagram. What that did was it showed other surgeons good techniques to operate on patients. So war allowed for more ideas to be generated, more practice to be had, and for more sharing to happen. During the Renaissance, that continued. So we've just got a continuation between medieval and Renaissance because we've got a lot of war in both. More in medieval times though, but there was significant progress made with the development of surgery. Parry's alternative ointment to boiling oil for gunshot wounds. Ligatures, of course, he also came up with as well for dealing with blood loss, and the use of artificial limbs. During the Renaissance, you had newer, more powerful weapons. Those led to new injuries, and they forced surgeons to experience new and different and more difficult wounds. And it also meant that surgeons had to work more under pressure and come up very quickly with new ideas. So our next period in terms of war, we're going into the 1800s, and of course at this point we've got mainly the Crimean War, which has an impact. Of course, it also involves individuals. All of these periods do as well. You've got the individual brilliance of Nightingale as well, who helped improve the cleanliness of hospitals and the standards of nursing. But remember, we're thinking about surgery in this question. There was rivalry created between Koch and Pasteur because of the Franco-Prussian War. That pushed them to make that discovery, obviously, of germs, and then, of course, the germ hunting, microbe hunting coming after that. And it helped the development of surgery because now that we had germs which had come out of war, that inspired Lister to develop antiseptic surgery in 1867 and that use of carbolic acid. And of course, that meant surgery became so much safer. So the 1800s wasn't quite such a time of war, but war still had an impact, in particular because it forced Pasteur and Koch to get that real rivalry because of the rivalry between those two countries, because of the Franco-Prussian War. And of course, it led on then to Lister making his discovery. He wouldn't have needed an antiseptic if they hadn't discovered germs. Modern times, well, war has had a massive impact on the development of surgery, and that's of course because we had 2 world wars in modern times. So warfare helped the development of surgery enormously. The first antibiotic was developed, mass produced for World War II, and that was penicillin, of course. And of course that was funded by the US government, and it saved thousands of lives. With the first successful blood transfusions, and of course that was essential to the development of surgery and successful outcomes in surgery, and that was due to World War I. They also in World War I discovered how to transport blood without it clotting, how to store it much more effectively, and X-rays and plastic surgery were developed due to both World War I and World War II. So World War I and World War II led to a whole raft of changes. So in total, war over time really did help push the boundaries of surgery and lead to some massive breakthroughs. Our second factor in the development of surgery is individuals. So key individuals have been important in the development of surgery since the Middle Ages. So in the Middle Ages, we've just got one individual really, we've got John Ardern. So he seemed to be the first English surgeon. So he worked on the battlefield, so this is very much linked to the last one, because when we talked about war, we talked about John Ardern as well. So when you're thinking about doing this kind of question, think about how you can make links between the different factors as well. And of course, he developed his own painkilling ointment, made from hemlock and opiums. Other surgeons would have followed his examples. These were forerunners for anaesthetics, which came later in the 19th century. He also wrote a surgical manual, a book showing his instruments and operations. Other surgeons used that to influence their surgery and build upon his success rate. Remember, about 50% of his patients survived operations, and that was pretty good for the time. He also set up a guild of surgeons, so a group of surgeons, kind of like a collective. It was banded together to kind of say, well, we're the best ones, we're kind of qualified. He did this to separate skilled surgeons from the less skilled barber surgeons, and this was the start of training and regulation. So John Ardern was really important as an individual and the only Middle Ages or medieval surgeon that we need to know about. In terms of the Renaissance, we have John Hunter. Now, he was an anatomist, so he's not actually known as a surgeon, but his work is really important because his books on anatomy help surgeons by showing the theories about the anatomy every surgeon needed to know. His writings were based on his observations, more particularly his dissections. So he did about 2,000 dissections in his career and all his different experiments. He trained, so it wasn't just that he did these 2,000 dissections, but he himself personally trained hundreds of other surgeons and set up a large practice. He made sure to train those people in the scientific approach, and this of course overall spread those surgical techniques among large numbers of surgeons. Many of those surgeons in their turn taught at universities, and so those skills were spread further and further. Vesalius and Harvey's work is also important. I mean, if we're thinking about key individuals, John Hunter is the most important, but Vesalius and Harvey were also important because their works on anatomy, circulation of the blood, allowed for later developments in surgery. And we have a whole range of individuals in the modern periods of the 18th and 19th centuries and also into the 20th and 21st century. So in terms of this earlier period, the 18th and 19th centuries, key individuals were significant in dealing with two out of the three main problems associated with surgery. So first of all, we've got pain, and this was dealt with through Simpson and the use of chloroform as the first effective anaesthetic. And this allowed for the development of surgery as more complex and longer surgeries could be attempted with the unconscious patients. This is about more complex, longer surgeries just because they now have the use of chloroform. On top of that, you've got this second key individual of Lister. Well, he was important because he dealt with the problem of infection. So we've already got anaesthetics, which meant that actually surgery became more dangerous because surgeons were taking more risks because their patients were unconscious. And so there was longer and more complex operations. Lister introduced the practice of antiseptic surgery. He uses carbolic acid in the operation. He used his instruments, bandages. Remember, he sprayed everywhere with his carbolic acid pump, and he reduced the number of deaths due to infection. And in fact, that he reduced it from, in his own surgery, 3 years, from 46% to about 15%. And this, of course, led on to the introduction of aseptic surgery. So a sterile environment by boiling and heating equipment and making everything much safer and much more complex. We wouldn't have modern surgery without the work of both Simpson and Lister in the 19th centuries. So they're two really important people. Then as we come into the 20th and 21st century, we've got a number of people again. We've got Karl Landsteiner. Well, he's really important because he discovered blood groups, and that allowed us to have, for the first time, safe blood transfusions. There had been blood transfusions going on actually for a very long time, but particularly being developed from the 1880s. But Landsteiner worked out that the reason why they weren't always working was because people had different blood groups. And that, of course, was essential because now surgery could be pain-free, it could be infection-free, and patients had a greater chance of survival because now they could have blood transfusions as well. So this was a massive, massive help in terms of surgery, massive help in the development of surgery. Then, of course, we've got Gillies and Makindo in terms of plastic surgery in both World War I and World War II. And finally, we've got Christiaan Barnard, who carried out the first successful heart transplant. So lots and lots of key individuals. You're not going to have to remember all of those key individuals, but if you can remember some from each, or at least one or two from each of those areas, you're going to do a really good job. The final area that we're going to look at, the final factor, is science and technology. Now, this time round, there is actually nothing really for us to say about medieval science and technology. That's okay, because we have talked about medieval in the other two paragraphs. So that's going to be absolutely fine. So we're starting with Renaissance because this is when technology really begins to develop. So the first bit of technology we can talk about is that Harvey made his discovery about the circulation of the blood due to watching water pumps. And that made him question how the heart pumped blood around the body. And of course, what that meant was, once they'd proved that blood circulated around the body, was understanding of arteries, veins, valves. So understanding this circulatory system within the human body meant that surgery could be developed now that they knew that blood was literally pumping around the body. Technology also held back surgery at this point, because it wasn't until after Harvey died that the powerful microscopes could really show a little bit more detail to his work and prove the existence of capillaries that would have enabled him to really prove his theory. A lot of people distrusted his theory because he knew that capillaries or something like it was there, but he couldn't show it. Also within this period, right at the end of the medieval period into the beginning of the Renaissance period, we get the development of the printing press. What that did was it allowed people like Paré to share his surgical development with a wider audience. He was able to show it with a much wider audience than someone like John Ardern, who was working more than 100 years before. So technology really beginning to make a difference during the Renaissance. Okay, so they've now got technology and science in the 18th and 19th centuries. So at this point, we have the first X-ray machine developed in 1895. And of course, that has a massive impact on surgery because now surgeons could see inside the body and see, particularly in war, where bullets or anything else was lodged, and it made surgery much less dangerous. Of course, at this time as well, we get the improved microscopes. They allow Pasteur to develop his germ theory. And of course, without germ theory, we wouldn't have the development of antiseptic and aseptic surgery. So all of those things had a massive impact. It's not directly obvious why these things had an impact on surgery, but they did have an impact on surgery because it led to antiseptic surgery. So remember, when we're thinking about this question, we're not just listing a load of things that were discovered, we're thinking about their impact on surgery. So of course, this then reduced the infection rates during surgery and death rates, and it allowed more complex and longer operations to take place much more safely than they had done in the past. And into the modern age, science and technology have been particularly important in the development of surgery. The development of computers has allowed for the development of microsurgery, fibre optic cameras, and lasers. All of this has led to keyhole and laser surgery, of course. Of course, you've got new drugs that have made operations safer and allowed for transplant surgery to be developed. Because when you have a transplant of any kind of internal organs, you need to have antiviral drugs, drugs that are going to stop you from having infection and rejecting those new organs. So that goes hand in hand, and that is, of course, the new drugs are also a form of technology. Radiation therapy has also been made possible by new technology. So all of these things lead to much more advanced surgery, but also surgery becoming much safer and having much greater rates of success over time. So the question that you're going to be answering here is, has such and such been the main factor in the understanding of or in the development of? Explain your answer with reference to something and other factors. So it'll become more apparent on the next slide what I'm talking about when I give you an example. But I just wanted to kind of talk about the general approach to this question. So some of the main factors that we'll be talking about might be war, superstition, religion, chance, government, communication. The ones we're focusing on are war, science and technology, and the role of the individual. You need to refer to whatever the factor is given in the question. It might be war that comes first, it might be the role of the individual, it might be science and technology, but you talk about that one first. Your second paragraph, you write about another one of them. Your third paragraph, you write another. And in total, there are 4 paragraphs because you're writing a conclusion as well. You write in detail and give specific examples from across the different time periods. And you need to refer to the statement at the end of every paragraph. Let's have a look at an example. So just to reiterate exactly what your question will look like, or your answer will look like rather, your first paragraph, you deal with a named factor that's used in the question. You try and give an example from each time period, if at all possible. It won't always be possible, but you do try and do that, and you show how that developed, whether it is public health or in this case, surgery. Then you do the same for another factor. Then you do the same for another factor. So paragraph 1 is the one that is named in the question. Then you have another factor and another factor. And then finally, you make a judgment. Do you agree that that named factor was the most important? If you do, why? Discuss that factor and the other factors, but actually show that combination, that link between the factors to really do a very, very good conclusion. Here's a question very similar to the one that you're going to be answering in the assessment. Has the role of the individual been the main factor leading to improvements in surgery? Explain your answer with reference to the role of the individual and other factors. So your first paragraph will be on the role of the individual and how individuals across those different time periods made improvements in surgery. Then you will do a second paragraph that will be about one of the other factors. So war could be the next one that you do. And you talk about war across the 4 different time periods and how that led to improvements in surgery. And finally, you do a third, well not finally, the third main paragraph, you will do science and technology and how that across 3 time periods this time, you're not going to do medieval this time, improved surgery. And then you end up with a conclusion where you decide, was it individuals that was the most important factor, the main factor that led to improvements in surgery? Or was it war? Or was it science and technology? There is no right answer. It's about your reasoning in the conclusion. Now you're going to have about 20 to 24 minutes to answer this question, which means that you can write detailed paragraphs. You're going to have about 7 minutes, maybe 6 to 7 minutes per paragraph, which means you can put in a lot of detail and you have got time to do that. The other answers, the 8-mark question, is going to be about 10 minutes. So you have got time to do this. So let's have a look at a really good paragraph that answers this question. So key individuals have been extremely important, so I'm going straight to the question, in the development of surgery since the Middle Ages. During medieval times, so I'm going straight to the first period, John Ardern worked as a surgeon on battlefields, where he developed his own pain-killing ointment made from hemlock and opium. Other surgeons followed his example. He also wrote a surgical manual showing his instruments and operations and set up a guild of surgeons in 1368, and this was the start of the training and regulations. In the Renaissance, John Hunter wrote books that helped surgery, showing theories about anatomy every surgeon needed to know. His writings were based on observations, dissections, and experiments, and he trained hundreds of other surgeons in that scientific approach, and this improved surgical techniques. In the 18th and 19th centuries, key individuals were significant in dealing with the main problems associated with surgery. Pain was dealt with by Simpson with the introduction of chloroform as the first effective anaesthetic, and this allowed for the development of surgery as more complex and longer surgeries could be attempted with an unconscious patient. Joseph Lister was also important because he dealt with the problem of infection. He introduced the practice of antiseptic surgery through the use of carbolic acid in the operation and soaked his instruments and bandages in carbolic acid and reduced the number of deaths due to infection. He managed to reduce the mortality rate from 46 to 15% in 3 years. This development led to an introduction of aseptic surgery, the creation of a sterile environment for operations, and this had allowed surgery to become safer and more complex. By the end of the 19th century, the only main problem solved was blood loss, and this was solved in 1901 by Karl Landsteiner. He discovered blood groups, and this allowed for blood transfusions to become successful. This is essential for the development of surgery. Lees was responsible for the development of plastic surgery in World War I, and Archibald Makindo developed it further in World War II. Surgery has continued to develop throughout the 20th and 21st centuries. Without these key people and their individual brilliance, surgery would certainly have developed more slowly. So what I've done throughout this whole paragraph is I have made reference to time periods. I've given names of people and specifically what they did. I haven't just listed what they've done, I've said how this has helped the improvements in surgery, how this has developed surgery over time. And I've just done a little sentence kind of bringing it together at the end. Now, I'm not going to give you a model for paragraphs 2 and 3. They are exactly the same. You have all the examples, you have all of that stuff on your sheets, all about war and all about science and technology. It is your job now to learn those. Give knowledge from across the periods, linked to each other where possible and to the question. If you know a number of examples about individuals, war and science and technology, this question will be a breeze. There's going to be no tricks in this question. It's going to be this question, but maybe with a slight twist, maybe with a changed first factor. But this is what you're preparing for. So of course, the final thing that you're going to have to do is you're going to have to do a conclusion. This is really, really important, more important than any questions that we've done so far. You need to make sure you actually answer the question. Has the role of the individual been the main factor? You need to make that judgment. I agree, I disagree, I partially agree with the statement. And then you give a reason for your choice that mentions the other factors too, but trying to show those interrelations of the factors. So acknowledging that the individuals, for example, may not have been able to do what they did had it not been for war or had it not been for the science and technology around at the time. Show that you have understood, number one, why you've chosen what you've chosen and how those factors relate to each other. And when it comes to surgery, all three of those factors that we've chosen are completely interrelated, which means you should be able to make reference to that in your conclusion. And of course, you have to show balance. So make sure, and that's talking about all of those factors within your conclusion. Don't just mention, yes, I think it was the role of the individual because individual was most important, they did the most, full stop. You have to mention all of them. You're going to come down on one side, you're going to pick one of the factors, but you need to mention all of them in your conclusion. So the last thing from today, again, is to revise. I want you to revise the content. This is the most important content so far. Make sure you really, really know this stuff well and the exam technique to make sure you're going to be successful when you actually sit the assessment.